Hello, my name is Robert Daniels, and thank you for taking the time to listen to my presentation on cultural diversity impacts on healthcare. First, I'm going to talk about the impacts on cultural diversity on healthcare. Convena Bacodi states that changing demographics and economics of a growing multicultural world and the long-standing disparities in the health status of people from diverse ethnic and cultural backgrounds has challenged healthcare providers to consider cultural competency as a priority. Being able to understand the impact that cultural diversity has on healthcare is an important concern. Due to the increasing diversity we are seeing from cultural perspective, Anderson, Shrimshaw, Fully Love, Fielding, and Norman express cultural competent healthcare systems, those that provide culturally and linguistically appropriate services, have the potential to reduce racial and ethnic health disparities. By advocating to bring awareness to the disparities that exist within healthcare, activists, doctors, nurses, social workers, and politicians have the ability to fight for change. The next topic we are talking about is the issues that are revolving around this problem. When it comes to disparities within healthcare, racial and ethnic can appear to be the most obvious. According to the Health Policy Institute at Georgetown University, people who do not have a regular doctor or health care provider are less likely to obtain preventative services or diagnosis, treatment, and management of chronic conditions. Moreover, being aware of the role that socioeconomic status plays within health care and the inequalities that exist can strive to allow for a more diverse and cultural competent healthcare system to exist within the United States. When we look at the available chart, a significant number of populations that are uninsured are Latino, African American, Asian, and American Indian descent. Furthermore, these same racial and ethnic minorities are also unlikely to have a regular doctor they see routinely. As a result of this, it is clear that disparities exist among non-white, non-Latino individuals. When it comes to being able to seek and receive treatment or receive a diagnosis, the Health Policy Institute at Georgetown University expressed that a culturally competent healthcare system can help improve health outcomes and quality of care and can contribute to the elimination of racial and ethnic health disparities. Anderson, Shrimshaw, Fully Love, Fielding, and Norman explain, when clients do not understand what their healthcare providers are telling them, and providers either do not speak the client's language or are insensitive to cultural differences, the quality of healthcare can be compromised. As a result of this misunderstanding, it can create barriers that lead to the patient's inability to communicate with healthcare providers. These cultural encounters that medical staff encounter when working with patients and family members are important to understand when it comes to the individual needs. Convena Bacodi suggests using a formal training interpreter may be necessary to facilitate communications during the interview process. Not only is being competent to clients' language and culture needs within the health field important, but so is having an understanding of inequalities that exist, such as socioeconomic status or SES. Williams, Muhammad, Leaville, and Collins state, research has found that some of the observed racial disparities in health reflect the effects of difference across population groups and socioeconomic circumstances, but that even after taking SES into account, racial disparities in health often remain. However, in order to be competent when it comes to cultures outside of one's own, it is important they are aware of any biases they hold. Kambina Bakoti conclude that cultural awareness is the process of recognizing one's own bias, prejudice, and assumptions about individuals who are different. Activists have worked to bring awareness to this need as early as the 1930s. Through national health reform campaigns such as the New Deal and the Committee of National Health Insurance of CNHI in the 1970s, while these movements brought forth awareness, nothing really ever happened. During the Obama administration, the Affordable Care Act, or ACA, was passed, which was aimed towards creating universal health care reform. In order to bring greater awareness to the disparities of cultural incompetencies that exist among healthcare, individuals must become activists for change. Hoffman states grassroots healthcare demands have also contained the seeds of a wider critique of the American healthcare system, leading some movement to adopt calls for universal coverage. Regardless, grassroots reforms have remained at the forefront of this issue and focused on areas such as desegregation of hospitals, access to abortion from a pro-choice stance, and AIDS. These areas still remain controversial topics that lead many individuals to having strong feelings either for or against the movements. Now we're going to talk about the plan for this issue. In order to begin addressing this issue, it is vital that healthcare becomes more accessible and affordable. The ACA was created with three primary goals in mind, according to Menchikanti, Helm II, Benjamin, and Hirsch, which were increasing the number of insured, improving the quality of care, and reducing the cost of healthcare. It was concluded in the same article that while healthcare had become somewhat more affordable, overall access has diminished. A plan needs to be created which keeps the affordability piece of the ACA while making healthcare more accessible. After all, what good is being able to afford healthcare when one is unable to use it? Ira explains, efforts to improve cultural competency among healthcare professionals and organizations would contribute to improving the quality of healthcare for all consumers. This would lead to a greater satisfaction in care being offered and received by patients. If these areas were taken into consideration, a culturally competent healthcare reform can be achieved that would meet satisfaction while being easily accessible and affordable. Finally, we are going to talk about the implications. It is vital that healthcare become more affordable and accessible for all, regardless of minority status within America, by understanding the needs of the various minority populations and the lack of accessible health care that exists. Where there have been activists who have expressed the needs for better, more affordable health care that have lacked the true ability to truly implement anything. Is there any questions?